Hi, my name is Romeo Bhatte. I'm a student nurse practitioner. What's your name?
My name is Payal Sundu.
Okay, Payal, I'm going to be recording this video and I will be posting it on the YouTube for my school purposes. Are you giving me the consent to go ahead and record this video?
Yes, sure.
Thank you so much. So, before starting this video, I already had done my hand washing. I checked my patient blood pressure and laying supine and laying and sitting up, and we used the proper cuff size. And we also made sure the patient, when we were checking the blood pressure while sitting, we made sure that we are the arm, left arm, is at the level of the heart. And both readings were accurate. My patient did not complain of any dizziness or syncope. And the next thing I'm going to be doing is checking for the jugular vein pressure. I have my patient on this side, and when I'm doing this, my patient's head is at a level of 30 to 45 degrees. So I give her a pillow to make the angle 30 to 45 degree. For this, I'm gonna be checking. There's a carotid pulse right here. And then right here, from the point internal jugular vein, from the point of maximum pulsation, and from the sternum notch, I will be checking my patient's JVP. The sternum notch. This is the point of maximum pulsation. My patient's JVP is 3.5 centimeter, which is normal finding. Now I'm gonna be palpating for both carotid pulses. Right on the other side. Okay, carotid pulses are palpable and then 2 plus. Now next thing I'm gonna be doing is checking the auscultating the carotid pulses with the bell and the diaphragm. Okay, on the side. Okay, carotid pulses are palpable and then grading 2 plus. And the next thing I'm looking at the chest symmetry. There is no heaves, no lifts, no precordial pulsations, no apical pulsations visible or noted. And next thing is the heart from the second intercostal space. It's an apical pulse. Then we have this left moving from second here right to the left. That's the pulmonic, and then we have a Erb's point, then we have a tricuspid, and the fifth intercostal is the mitral valve. So apical, pulmonic, then Erb's point, tricuspid, and mitral valve. And then PMI is from the mid clavicular to the fifth intercostal. That's the PMI here. Okay. So now I'm going to be listening to the heart sounds from the second intercostal on the right side. Then left pulmonic. This was the right side was the apical pulse. This is the pulmonic. And then third intercostal is the earth point. That's the earth point. I was able to hear S1 and S2. And then the fourth intercostal is the tricuspid. And then fifth intercostal at the apex of the heart, mitral valve. And we can hear, we can also check for the S2 splitting when we can have a patient take a deep breath, and then the S2 splitting can be heard, because at this time both aortic and pulmonic valve close. So go ahead and take a deep breath for me. Okay, so that's how we can hear the S2 splitting, but in this case I did not hear any S2 splitting, no murmur, no gallops noted. Now I'm going to be palpating for the aorta, abdominal aorta. Okay, now I'm going to be listening for the auscultating the abdominal aorta. The diaphragm, which is the aorta is above the umbilicus, diaphragm and the bell. No thrill noted. Now I'm going to be checking the renal arteries bilaterally with the diaphragm and the bell. Then we have an iliac artery, the diaphragm, bell, iliac artery on this side, diaphragm and the And then we have the femoral arteries, diaphragm and the bell. On this side, diaphragm and the bell. No thrill noted, no masses, no tenderness, no complaint of pain by my patient. And now I'm going to be looking at the overall, the peripheral exam. My patient, both upper and lower extremity, no swelling, no edema noted, no cyanosis. And if I'm looking at my patient's hand, the nails are pink. There's no cyanosis, no clubbing. The cap refill is less than 3 seconds. Checking both sides. Cap refill less than 3 seconds. Nails are pink, and no clubbing, no hemorrhagic splitting, no tanning of the nails noted. And same thing on the lower extremity. There's no discoloration, no cyanosis, no edema, no varicose veins noted. Now I'm gonna move on to the pulses. So first of all, I'm gonna be checking the radial pulse. Right hand, left radial pulse. Those are both equal bilaterally and grading 2+, and they're brisk. Now moving on to the brachial pulses. Equal, 2+, brisk, and then we have femoral. Equal, brisk, 2+, and then I have a popliteal pulses behind the knee. Equal, 2+, and now I'm going to be checking for the dorsalis pedis. And 2+, and then the posterior tibialis. Posterior tibial. Okay, those are all the pulses, have a grading of 2+. They are bilaterally equal, and that's all. Do you have any questions for me?
No, thank you.
Thank you.